I'd like to welcome you to a primer on one of the cornerstones of our model of care delivery, interdisciplinary team rounding. If done correctly, this can help the team gather data, communicate the care plan, and connect to patients. All right, let's see one of these episodes play out.
Hey Valerie, it's Dr. Tantoko. I'm gonna go see room 4, Mr. K next. Are you free to join me? Great, I'll see you there.
Rounding starts with gathering the team, and that includes contacting your nurse. Their number should be available on assignment sheet on each unit, but is also available in the EMR.
Hi.
Hey, good morning.
Any significant events for Mr. K?
Yeah,
overnight?
so last night he was feeling a little short of breath. They actually ended up putting him on a little bit more oxygen than they had previously. He was on 2. They ended up putting him up to 3. They were able to bring him back down, and his heart rate has just been kind of fluctuating from normal sinus to tachy. So that's pretty much it. No real other complaints though.
Okay.
Yeah.
Let's go see him. Good morning.
Morning.
How are you doing today? Good morning.
Struggling. I just got up for a wash, and so my heart rate is going nuts.
By gathering with your team first, new information learned at the bedside can be placed in context. Then the team can decide and explain if the plan of care will be changing for the day. Remember, connecting with your patient is an important part of this rounding.
Well, our plan for today is to get an echocardiogram or an ultrasound of your heart and try to wean down the oxygen if we can. Is there anything else from the checklist that we should address?
So his telemetry, like you said, it's been showing that it's been tachy. It does need renewed if you want to keep it on. We did that EKG earlier. It showed normal sinus, but that's while he's sitting in bed and resting. But then once he gets up, it's just jumps all over the place. O2 saturation has been okay. Otherwise, I know he feels more comfortable with it on, right?
The goal of team rounding is to understand the current condition of the patient and define the plan of care so that everyone can effectively do their part. To achieve this goal, 3 tasks should be accomplished on each patient. Gather the team, define the plan of care without missing important details, and communicate effectively to the patient. All right, let's watch another one of these episodes play out.
Do we have any other patients together?
Yeah, I think we have room 16 and 38.
Okay, great. Let's see him
Sure.
next. Any significant events for Mr. L tonight?
Nothing too much. He did finally have a good bowel movement from what I was told last night, and seems like he's doing better. So I think that's about it for him.
Okay, good.
Good morning.
Good morning.
Hello.
How are you doing today?
Much better.
Good, good. Any pain?
Yeah, the leg is kind of tired.
Your hip? Yeah. And I saw you were walking with physical therapy.
Yes.
How did that go?
It's not too bad. It's kind of worn me out.
Oh, yeah. Yeah. Is there anything from the checklist that we should address?
Checklists have become common in medical practice and work best when brief and focus on high-value, easy-to-miss practices. As such, many units have developed their own checklists. These can and should be modified with the input of each team. While each patient is unique, checklists should contain common elements that address quality and safety priorities and reminds teams to leave time for open Q&A. Each team member should understand why each element of the checklist is important.
You know what? I think he's been doing pretty good with everything. He's been turning, so his bottom's looking better. He's been able to pee and everything, so no need for Foley's or straight cathing, anything like that. Ron, did you have any concerns?
He's getting close to discharge, possibly, if he's medically stable. So the question is, I think ortho originally said that they wanted him to come back. We live in Worcester, which is, an hour and a half ride away. So I was wondering if it's possible to talk to ortho and maybe do the first visit here instead of being discharged and immediately come back for the first visit.
This time for questions, prompts the entire team to consider their concerns, and it often allows us to engage with patients or their families. This can avoid many misperceptions and leads the whole team to think more broadly about important questions like discharge coordination. Let's see another team at work.
All right, so PM&R, PO pain meds. I've stopped his bowel regimen. Hopefully he'll have a better day.
Okay.
Okay.
Sounds good.
Moving on.
Checklist.
Yes.
This group has more members, so they have more discussion outside the room, where they review the major priorities with access to the EMR.
Okay, we're going to talk about Mr. Let's have Lindsay, anything from overnight? Any questions or concerns from this morning?
Not that I know of. He's still an add-on for surgery today. Okay, so we'll hold his Lovenox. Other than that, he was asking if he can go home tomorrow.
Okay.
All right. He's a 34-year-old status post, unrestrained driver, MVC, possible loss of consciousness, with a right upper extremity radial and ulnar styloid fracture and a posterior dislocation of his elbow. He had multiple facial lacerations and scalp lacerations. And a left lower extremity, several metatarsal necks were fractured.
Is there anything else on the checklist that we have not encountered? All right.
No, checklist is complete.
Okay. Hi, Mr. Dr. Rushing, I've got the whole team here. Okay. How are you doing this morning? All right. Are we ready for the big day, surgery today?
I guess.
Okay. How was your night last night? Any problems?
I slept hard, you know, and messed me. I slept all night, so.
Okay. And how are we doing with your pain management?
This type of bedside rounding is more focused on patient communication and less focused on data gathering because members of the team have already rounded outside the room. Remember, if you choose this approach, always be listening for changes to the plan because adjustments may need to be made. Other teams may choose to combine the data gathering and communication events into one seamless bedside activity. Let's watch one final team to see what this might look like in practice.
Knock, knock. Good morning. Good to see you this morning, sir.
Good morning. Nice to see you too.
Got the whole team here,
Good
so we'll be
morning
huddling
again.
in here. Good to see you this morning.
Good morning again. Nice to see you.
All right.
Hello. How are you?
Good. How are you?
Good. How are you? Good morning.
All right. Do you mind if we mute the TV real
Well,
fast?
no, we were just trying to find this.
Actually, it's over there. If you want to just press the mute button.
Fantastic. So we'll just kind of run through things here. Caitlin, anything with nursing overnight?
No, my only questions would be if he can come off of tele and if there's a plan for PTOT.
Okay. Yeah, and so we'll just kind of see, how are you feeling overnight?
Feeling good.
Feeling good?
Feeling good.
Okay, we did see on the telly that looks like your heart slowed down a little bit while you were sleeping, but that can be normal with people. Were you having any symptoms overnight?
No
when
symptoms.
your heart rate
Felt
was
fine.
low? Okay. No feeling chest pain at all?
No.
Any shortness of breath?
No, felt fine.
Okay. Any more episodes of feeling like you're going to pass out?
No.
No. Okay. So it seems like stopping telly is definitely a reasonable thing to do at this point today. So otherwise, eating and drinking okay?
Yeah.
Okay.
Yeah.
Moving your bowels?
Yes.
All right. How's urination for you?
Been fun.
Good.
Yeah.
Okay. So I know the main thing we were waiting on for today is to see what comes back out of your urine cultures.
Right.
Because we think your urinary tract infection maybe have played a little bit of a role in your kind of passing out at home the other day.
Right.
So I know we have you on the broad spectrum antibiotics through your IV right now.
Right.
And once we get some more data about what bacteria is causing this infection, we can kind of narrow those antibiotics a little more and maybe get you on something by mouth.
Okay.
So it seems like right now most of your symptoms have resolved. So as soon as we can get you on an oral antibiotic, we can work on getting you out of here.
Good.
Okay.
Good.
So potentially today, if we can talk with pharmacy, at the bare minimum, probably tomorrow. So
Okay.
it all kind of depends on how much we get back today.
Understand.
Okay.
Today. Yeah.
All right.
Over today. Yeah.
And then as far as PTOT, I think that'd be a very reasonable thing to get going today, just so you don't get too deconditioned while you're here.
Okay.
Sound like a game plan to you?
Sure.
All right. Any other concerns that you guys have for us right now?
Can I ask a couple questions?
Sure.
With his heart rate lower at night, he is going to go through a sleep test. A sleep. We're going to go to KCH, and he's going to spend the night because he does need a CPAP machine because he's already done.
This team goes on to proceed with their exam, checklist, and wrap-up. This may seem like a bit of a different process, but all the core elements are there. They gathered the team, got an update from overnight, and went around the horn to get a report. This style also allowed the family to address their concerns in real time. So while this is only an overview and not a comprehensive discussion, it does capture our collective expectations. If you achieve this kind of experience, everyone in the hospital benefits. As you encounter or anticipate complexity in your patient's care, whether it be discharge planning, expectation management, or care coordination issues, know that this foundation of team communication can facilitate its rapid resolution. Remember our goals. Gather the team, discuss the plan of care, and ensure the patient's input. That is team care at The Ohio State University Wexner Medical Center.